teach you what you can do for male factor infertility. Looking at infertility in infertile couples, I think there's a misconception that in most cases it's a woman's issue, a woman's problem, where in reality, I would say that about 50% of couples that suffer from infertility issue is with the male. We've actually come a long way in being able to assess male fertility in all different ways. So in addition to the standard sperm analysis, which has been around forever, there's more sophisticated ways to identify the viability of the sperm and the ability of the sperm to actually create a viable embryo and a baby. So whenever we evaluate a couple, we look at the male, and if there's any issue with their sperm viability, there's more powerful tools now to try and narrow it down and try to understand exactly what the cause is. And once you know the cause, it makes it easier to treat. So there's many different treatments available depending on the problem. And for those cases where the cause cannot be found or the sperm cannot be improved, we also have tools to work with the existing samples through mostly in vitro fertilization. And even in cases where the sperm is very low in the count or very low in their motility or function, still able to create embryos and achieve a successful outcome.